Happy Nurses Day!
Hello everyone, I just want to wish you all Happy Nurses Day, and again my grateful thanks to all our nurses and their colleagues for providing great patient care, doing a brilliant job. I hope some of you have had the chance to come to our Nurses Day conference, which is a bit early on the 8th of May, and if you didn't, we hope to see you again at one in the future. So thank you everybody, and again Happy Nurses Day.
I love my role because it gives me the freedom and the opportunity to work alongside different specialties and to be able to improve my skills and everything I need to develop my career.
I love my role because the trust allows me to develop my career.
What I love about this role is to help the people feel better, and even in their houses, you can always be a patient advocate, and it's very rewarding. At the end of the day, you always feel so relieved that you're able to help the people in the midst of their houses.
What I love about being a community nurse is to make the difference to vulnerable people and to make them smile.
What I like my role as a community nurse is being able to visit the patients day by day, almost every day, and trying to make a difference and helping them become more independent and seeing the smiles on their faces when we visit them every day.
I love my job. I work very closely with families and children in their homes. We have a lovely relationship with the children, and we work with them in their homes instead of in hospital settings.
And what I do love about my job is I get to meet people in their houses, get to share joy with them, serve them, help them with their nursing care, and it's very rewarding.
I became a nurse because I really wanted to make a difference to children and their families at some of the most difficult times in their life, and 20 years on, that's the same. What I love about what I do now is I get to make that difference at scale. I get to influence the services and the teams and the systems that manage that care, and whether it's a child at home receiving end-of-life care or whether it's a complex needs child in school being supported, I get to make sure that the right people with the right skills are in the right place to support them.
I love my role as a community staff nurse because I get to help patients in the comfort of their own homes. Also, because I work with a pretty special team, they're all very supportive and they're the best team I've worked with.
Happy Nurses Day 2026. Thank you so much to all of our nursing community across the organisation. We have so many wonderful colleagues who are such fantastic examples of brilliant nursing. I'm a proud nurse myself, a mental health nurse originally, and I just love the fact that we have such a broad range of different types of nurses across the LCH, so enjoy the day.
What I love about my role as a community nurse is that in the middle of somebody's worst day, I get to be that small piece of calmness or peace in their lives by listening to them, offering solutions, or just by being there and they can talk to me.